I felt this strange discomfort in my chest, like a crushing pain, unlike anything I'd ever experienced before. The pain crept down my left arm, and I knew something was terribly wrong. Ignoring it wasn't an option. It was like a siren blaring inside me. I rushed to the nearest emergency room, my heart pounding in sync with the fear that had gripped me. The drive felt like an eternity, each minute stretching into what seemed like hours. I prayed I wouldn't pass out before reaching the hospital. This was a matter of life and death, and I knew it.
John, a seemingly healthy 40-year-old, felt a strange discomfort in his chest. It was a crushing pain, unlike anything he'd ever experienced. The pain crept down his left arm, sending shivers of fear down his spine. He knew something was terribly wrong. Ignoring the pain wasn't an option. It was a siren blaring inside him. He rushed to the nearest emergency room, his heart pounding in sync with the fear that had gripped him. The drive felt like an eternity, each minute stretching into what seemed like hours. John's mind raced, fear mingling with the throbbing pain in his chest. He prayed he wouldn't pass out before reaching the hospital. This was a matter of life and death, and he knew it. The emergency room was a blur of activity as John stumbled through the doors. He gasped for air, his words barely audible as he described the crushing pain to the triage nurse. The nurse, a seasoned professional, recognized the urgency in John's voice and the pallor on his face. This was no ordinary case of heartburn.
Sir, please lie down here. We'll take care of you.
Within minutes, John was lying on a stretcher, an oxygen mask strapped to his face. An emergency physician, Dr. Smith, hurried over, his face etched with concern as he listened to John's labored breathing and rapid heartbeat.
Tell me about the pain,
Dr. Smith said, his voice calm and reassuring. John struggled to describe the sensation that had gripped him, the crushing weight on his chest that refused to relent.
It's like a heavy weight on my chest and it won't go away.
Dr. Smith suspected a heart attack. He knew time was of the essence. Dr. Smith wasted no time. He ordered an electrocardiogram, EKG, a test that would reveal the electrical activity of John's heart and confirm his suspicions. The results were concerning. John's EKG showed a ST segment elevation, myocardial infarction, STEMI, a serious type of heart attack where a major artery supplying blood to the heart is completely blocked.
We need to act fast. Administer nitroglycerin.
Dr. Smith immediately administered nitroglycerin, a medication that helps to dilate blood vessels and improve blood flow to the heart. John's chest pain began to subside, a small victory in the battle to save his life. An aspirin was given to prevent further clotting. The next step was crucial, opening up the blocked artery and restoring blood flow to John's heart. He was whisked away to the cardiac catheterization lab.
We're ready to proceed with the catheterization.
There, a team of skilled cardiologists worked swiftly, guiding a thin tube through an artery in John's groin up to his heart. The procedure was a success. The blockage was identified and a stent, a tiny expandable tube, was inserted to keep the artery open and allow blood to flow freely. John was fortunate. He had survived a major heart attack and was on the road to recovery. He spent the next day in the hospital, his heart monitored closely as he regained his strength.
I'm so grateful to be alive. This experience has changed my life.
John's story is a powerful reminder of the importance of recognizing the symptoms of a heart attack and seeking immediate medical attention. Time is muscle when it comes to heart attacks. The sooner treatment is received, the better the chances of survival and a full recovery. John's quick thinking and the swift actions of the medical team had saved his life.